Hello and welcome to Abdomen 2, and we are going to focus on peritoneum and organs of the abdominal cavity, specifically the esophagus, gastroesophageal sphincter, and then the stomach. So at the end of this module, the students must be able to identify the parietal and visceral peritoneum, identify and describe the five major peritoneal folds, discuss the layers of the wall of the gastrointestinal tract, identify the organs of the abdominal cavity, describe the location of the different organs of the abdominal cavity in relation to each other, and of course, compare the features that distinguish the esophagus and then the stomach. So we have here an image of our abdominopelvic cavity. So it actually, if you look at the picture, it actually includes the pink and then the green cavities. So the abdominopelvic cavity is the region of the trunk that extends from the diaphragm here above and up to the pelvic floor below. So the pelvic inlet marks the anatomically arbitrary boundary line that demarcates the upper abdominal cavity from the lower pelvic cavity. So this is your pelvic inlet right here. This abdominal cavity, take note that it contains many vital organs, and it includes the GIT or the GI tract, the liver, the pancreas, spleen, and some parts of the urinary system. Next is the peritoneum. So take note that it is the largest serous membrane of the body. Okay, so it is divided into two. We have the parietal peritoneum, which lines the wall of the abdominal cavity, which is the innermost layer of the abdominal wall, as what we have discussed in our first module in the midterms. And then we have here your visceral peritoneum, which covers some of the organs in the cavity and their serosa. Okay. Next, we have here your peritoneal cavity. So it is a slim space containing lubricating serous fluid that it is found between the parietal and the visceral portions of the peritoneum. Okay, so that is your peritoneal cavity. So this peritoneal cavity, like your pericardial cavity, also contains fluid, and the fluid is called your peritoneal fluid. So it is just a small amount of serous fluid to provide lubrication between the parietal and then the visceral peritoneum. Now, in some cases, if there are or if there is accumulation of several liters of fluid in the peritoneal cavity, so that cavity or the peritoneal cavity may be distended. So it will lead to a diagnosis or to a disease called your ascites. So in the peritoneum, the organs are divided into two. We have the intraperitoneal organs and the retroperitoneal organs. So imagine that this is the posterior part, and then this is the anterior part. So intraperitoneal organs include the stomach, the jejunum, the ileum, and then the spleen. So an organ is intraperitoneal when it is almost totally covered with visceral peritoneum. So the stomach, jejunum, ileum, and spleen are good examples of the or intraperitoneal organs. Next, on the other hand, we have the retroperitoneal organs. So these organs lie behind the peritoneum and are only partially covered with visceral peritoneum. So mostly, actually retro or posterior to the peritoneum. Okay? So again, these are your pancreas, ascending and descending colon, and of course the kidneys. So you can actually see it here in the picture. Take note that an intraperitoneal organ, for example, the stomach, this one. So the stomach appears to be surrounded by the peritoneal cavity, but it is covered with visceral peritoneum and is attached to other organs by the ommenta. Okay, so no organ, however, is actually within the peritoneal cavity. So it's actually it. If we look at this picture, the peritoneal cavity is right here in between, or the white area here in between the visceral and the parietal peritoneum. So as you can see, there is no organ or abdominal organ that is actually within or in between this peritoneal cavity. So let's discuss the five major peritoneal folds. So we have first the greater omentum. So as you can see in the picture on the right side, it's actually fatty. So it is also known as the fatty apron. It is the longest peritoneal fold in the body. It is actually called the fatty apron because it drapes over the transverse colon. This is your transverse colon. As you can see, though, it looks like a draping, and then um, it also drapes across the coils of the small intestine. So as you can see, it's yellow, so it usually contains adipose tissue. And this adipose tissue, when they accumulate, it is also known as your beer belly. So for the beer belly, it's known as your greater omentum. Next is the falciform ligament right here. So actually, the falciform ligament just attach the liver to the anterior abdominal wall and towards your diaphragm. Next, the lesser omentum. So this part is your lesser omentum. So it arises as an anterior fold in the serosa of the stomach and then the duodenum. So it actually connects the stomach right here and the duodenum here towards your liver. So it actually serves as pathway for blood vessels also. Next, we have the mesentery. So actually the mesentery is fan-shaped. Okay, again, the mesentery right here is fan-shaped. It actually binds the parts of the small intestine like your jejunum and ileum to the posterior abdominal wall. So in cases of patients who are obese or who are considered obese, this mesentery is actually extensive and it may lead to a presentation in a patient who is obese who has a large abdomen. Next is the mesocolon. So the mesocolon is divided into two. We have the transverse mesocolon and then the sigmoid mesocolon. So the mesocolon binds the transverse colon and the sigmoid colon of the large intestine to the posterior abdominal wall. That's why it's divided into two. We have the transverse mesocolon and the sigmoid mesocolon. So we're done with the five major peritoneal folds. So let's look at the digestive tract or the GI tract or gastrointestinal tract. So of course, it starts off with the mouth, then the pharynx or the throat, then the esophagus and the stomach. So in this module or in this recorded lecture, we are going to focus on the esophagus and then the stomach. Before we start with the organs, let's discuss first the layers of the GI tract. Okay? So it's actually from the innermost layer up to the superficial layer. So the innermost or the inner lining of our GI tract is the mucosa. So it consists of the epithelium, the lamina propria, and then the muscularis mucosae. So it is composed of that epithelium, which is in direct contact with the contents of the GI tract, and then a layer of connective tissue called your lamina propria, and lastly, the muscularis mucosae. So this muscularis mucosae is a thin layer of smooth muscle in your mucosa. So actually, this part is your mucosa right here. So as you can see, it is actually in contact with the food itself, okay, or with the gastric juices, for example, in your stomach. Next is the submucosa. So this submucosa consists of areolar connective tissue that binds the mucosa to the muscularis. So if you look at it, your submucosa is between your mucosa and then the muscularis layer. It contains many blood and lymphatic vessels that receive absorbed food molecules. So it might be vitamins, fats, or proteins. Also, it is located in the located in the submucosa is an extensive network of neurons known as your submucosal plexus. And the submucosa may also contain glands and lymphatic tissue. Next layer, of course, after the submucosa is the muscularis layer. So take note that it contains both skeletal and smooth muscles, specifically in each organ. So in the mouth, in the pharynx, superior and middle of esophagus, and of course the external anal sphincter or EAS, they contain skeletal muscle. So they are mostly voluntary. On the other hand, in some parts or in the rest of the muscularis layer, the rest of the gastrointestinal tract or digestive tract, it contains a smooth muscle. So it may be divided into two. They have circular and longitudinal fibers. Now, aside from these two sheets of smooth muscles in the muscularis layer of the GI tract, it actually gives you involuntary contractions. For example, in the stomach, it gives you involuntary contractions, like, for example, peristalsis, so that the food will move, for example, from the esophagus down to the stomach, and then it will move down to the small intestine and then the large intestine. Okay, so that's the function of the smooth muscle cells in muscularis layer of the GI tract. Next, the serosa. So this serosa is the superficial layer, and it is also known as the visceral peritoneum because it's actually part of the visceral peritoneum already. Okay, so however, in the esophagus, this layer is known as the adventitia and not the visceral peritoneum. So after the layers of the GI tract, let's discuss each organ. So let's first discuss the esophagus. So as you can see here on the image on the right, the esophagus is a collapsible muscular tube. Okay, so its length reaches at about 25 centimeters, and it has sphincters. First sphincter is the upper esophageal sphincter. Next, it is also known as a skeletal muscle. It divides, or is found between the pharynx and then the upper part of the esophagus. Next is the lower esophageal sphincter, or your LES. So this one is a smooth muscle cell or smooth muscle. And of course, it regulates the movement of food from the esophagus down to the stomach. So it is found between the stomach and then the esophagus. So the esophagus enters the abdomen through an opening in the right crus of the diaphragm. So as you can see here, this part is your diaphragm. And then this is actually your esophageal hiatus right here in this area. So if there are any hernia, so it is known hernia or conditions like hernia, it will be called as your hiatal hernia. So in relation to a condition regarding the esophagus, we have here the GERD, or your gastroesophageal reflux disease. So in this condition, there is reflux of the acid stomach contents into the esophagus. And the causes includes failure of the lower esophageal sphincter, or for example, failure to close, hiatus hernia of the diaphragm, okay, and abdominal obesity. So the patients may present with heartburn in patients with gastroesophageal reflux disease. So as you can see here, normally the lower esophageal sphincter, or your LES, should close to prevent a reflux of the food towards, or the gastric contents toward your esophagus. However, in patients who have GERD, there is an open sphincter, and it will the gastric contents, which is mostly acidic, will go inside your, or will go back towards your esophagus. Okay, so that's why the patients may present with heartburn. And next, the stomach. So let's discuss the stomach. So the stomach is a J-shaped enlargement of the GI tract directly inferior to the diaphragm in the abdomen. So as you can see, it lies under cover of the lower ribs, and it connects the esophagus to the duodenum. So if this is esophagus, this is the stomach, and then this is the duodenum, or the first part of your small intestine. So the stomach is the dilated portion of the alimentary canal and has three main functions. Food storage. So food storage, actually, it's also known as the holding reservoir of the food. Okay, so in adults, your stomach can fill, or can be filled up to 1,500 ml of content. Next, it actually forms chyme. So if your food from your mouth goes into your esophagus and it meets the gastric secretions in your stomach, it will become now your chyme. So that's why your